Hello everyone, welcome to this ASN Kidney 360 podcast. I'm Sumit Kapoor, Assistant Professor of Medicine in the Division of Critical Care Medicine at Montefiore Medical Center, Albert Einstein College of Medicine. I'm joined by my co-author Jyotsana Thakkar, who is Assistant Professor of Medicine, Division of Nephrology, Internal Medicine, Montefiore Medical Center. Today we will discuss our study entitled Characteristics, Outcomes and 60-day hospital mortality of ICU patients with COVID-19 and acute kidney injury, published in Kidney 360 this December. So Dr. Thakkar, please describe your study population.
Hello everyone. The study population in our retrospective observational study consisted of adult COVID-19 positive ICU patients who developed AKI at ICU admission or during the course of ICU stay. The study period was from March 10 to April 11, 2020, a total of 32 days. We excluded patients with end-stage renal disease, pregnancy, and history of kidney transplant. Dr. Kapoor, what were the major outcomes in hospitalized COVID-19 patients?
So out of 300 adult admissions to our ICU during the study period, 224 patients developed acute kidney injury with the cumulative incidence of 74.6%. The mean age of our patients was 60 years and majority of them, 62%, were males. Compared to patients who did not develop AKI, patients with AKI were older, had higher BMI, and had statistically significant higher incidence of diabetes, hypertension, and smoking. Majority of our patients, about 97% of them, needed invasive mechanical ventilation for moderate to severe ARDS. And 50% of our patients required kidney replacement therapy. The median number of days of kidney replacement therapy was 7 days. 70% of the patients requiring kidney replacement therapy died, and of the 34 survivors requiring initiation of KRT, 25 were able to be weaned off KRT completely before hospital discharge. The 60-day in-hospital mortality was 66.5%. Dr. Thakkar, what factors were associated with patient survival in this population?
Our in-hospital non-survivors at 60 days had higher level of admission and peak creatinine levels, higher admission hemoglobin, and peak phosphate level compared to survivors. With multivariate analysis, we found advancing age, serum potassium, and hemoglobin levels on admissions were predictors of risk of in-hospital mortality. Dr. Kapoor, how do your results compare to those in other large published series?
So results of our retrospective study are very similar to earlier published studies showing a higher incidence and poor prognosis of AKI in hospitalized COVID-19 patients requiring ICU admission. Majority of the COVID-19 patients in ICU, they developed severe stage 3 AKI and also had a need for kidney replacement therapy. Outcomes are poor in COVID-19 patients requiring KRT in ICU. We also report a higher 60-day mortality of 66.5% than previous studies. And our higher mortality is because of the fact that our follow-up is longer, 60 days, and our population consisted of underserved African Americans and Hispanics. We also found that AKI in COVID-19 is very closely associated with the need for the mechanical ventilation, which is similar to the study by Hirsch et al. We did not observe any differences in outcomes based on peak stage of AKI or the severity of AKI. This is in contrast to the study by Lim et al., who reported that stage 3 AKI was associated with higher mortality compared to stage 1 AKI.
So, in brief conclusion, COVID-19 requiring ICU admission is associated with an extremely high incidence of severe AKI and requirement for kidney replacement therapy. The majority of COVID-19 patients with AKI in ICU have moderate to severe ARDS and require invasive mechanical ventilation. Timing or severity of AKI did not affect outcomes. We report a high 60-day hospital mortality of 66.5% in our population. COVID-19 patients with AKI requiring KRT have higher mortality, but survivors have good rates of liberation from KRT, 73.5% in our study. Thank you for joining us for this Kidney 360 podcast.
Thank you very much.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only. and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition, or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.